Hey everyone, welcome to another audio podcast on the Excerpts Equipoise chapter. This is the Shientist, and this is another Storm Robotics production. Today, today I'm going to provide an overview in context of an excerpt surrounding the adverse effects of anabolic androgenic steroids on renal health. So the excerpt around this is that in context of the introduction, CKD is a general terminology for heterogeneous disorders affecting kidney structure and function, and it's been associated with significant healthcare costs, morbidity, and mortality. Androgenic anabolic steroids, or AAS, are synthetic derivatives of the male hormone testosterone. AAS exert strong effects on physiology that may be advantageous for athletic performance. However, some investigations have identified the abuse of AAS by athletes, and this could lead to CKD. The aims around this works was to determine how abuse of AAS could lead to CKD, and the design and methodology around this included where there was a search strategy, a literature search strategy implemented according to was implemented wherein a PRISMA guideline was implemented to identify articles published between 2010 and 2021 and randomized clinical control trials, prospective and retrospective human studies, case series, as well as case reports and experimental in vivo studies were included. And the discussion around this was that AAS can affect pathways such as stimulating renin-angiotensin aldosterone system, enhancing the production of endothelin producing reactive oxygen species, overexpression of pro-fibrotic and pro-apoptic mediators, for example, TGF beta 1, as well as inflammatory cytokines, for example, TNF alpha, IL-1B, and IL-6, and renal biopsies have revealed acute tubular necrosis and development of glomerulosclerosis. The conclusions around this work was, in context of the excerpt at least, is that the abuse of AAS results in CKD and can result in other forms of renal disease. Some of the terminologies around this work can be identified in context of other evidence-based literature. Growth hormone, for example, growth hormone, anabolic, androgenic steroids, and kidney injury. The acknowledgements are to Anang, and wherein there was a collaborative effort between an academic institution and the Renal Patient Support Group, the RPSG. Once again, the excerpt around this, the excerpt here was around the adverse effects of anabolic androgenic steroids on renal health. And once again, this was another Storm Robotics production.